COVID-19 cases are once again surging in parts of the country, including the northeastern U.S. The governors of New York, New Jersey, and Connecticut are urging residents to avoid all unnecessary or non-essential travel among the three states. They are not imposing mandatory quarantines at this time. Let's bring in New York Lieutenant Governor Kathy Hochul. She joins us now from New York City. Lieutenant Governor, thank you so much for joining us. What kind of projections is the state looking at as we head into the winter months?
Well, we've said all along that this is our vulnerable time. Children are back at school, college students are back. People will no longer be congregating so much outdoors as indoors. So we don't have exact projections, but I do know that because of what Governor Cuomo and our administration have done, we have just about the lowest infection rate in the nation right now, and we're working tirelessly to keep that where it is, or even take it lower. It all comes down to more contact tracing, more testing. We did 136,000 tests across the state just yesterday alone. So we can actually micro-target exactly where the infection is spreading, deploy rapid testing kits. I went and watched this in the southern tier where we're having an outbreak and had a chance to see how this is operating and how people are taking advantage of it. So we know how to handle it, but our projections are, it could get worse. And we're trying to be very vigilant in terms of making sure we protect New Yorkers. We don't want people from other states where the infection has gone up higher because, unfortunately, many states, they listened to the president and didn't listen to the experts like we did here in New York. So we're going to do everything we can to try and get through what could be a very rough fall and winter.
Well, as you know, New York City schools have been able to reopen with relatively few positive COVID-19 tests. It is the nation's largest school district. What are they doing right?
Well, this is quite extraordinary, but they're following protocols that our administration developed over the summer. We wanted to make sure that every school district knew that they had to meet very high standards for disinfecting, social distancing, mask wearing, and also if there is a positive case, how we immediately contact trace, isolate, and make sure that it can't spread. So that's been working successfully thus far. It is really early in the process, though, to declare victory because kids are just starting to come back. There's some districts that still don't have children there 5 days a week. It's mostly a hybrid situation. About 460,000 students are doing that right now. So, you know what, we're still anxious about it. And I understand the teachers who have been out there taking it on the chin, trying to figure out how to get their own kids educated while maybe doing some of these classes from home. And it's been a tough time for them. Parents are absolutely at wit's end. And the students themselves, just not sure if they're coming or going these days. So we're not out of the woods at all in that respect, but it is absolutely coming along much better than it has been in other major cities, that's for sure.
Well, Governor Cuomo launched a preliminary plan to distribute a potential COVID-19 vaccine, which would bypass the federal government. Here's what he said about it last month. Let's listen.
The first question is the vaccine safe? Frankly, I'm not going to trust the federal government's opinion. And I wouldn't recommend to New Yorkers based on the federal government's opinion.
So first, does New York State have the money to fund its own plan? And would that potentially delay New York residents from getting a coronavirus vaccine if and when one is available?
The governor has addressed this almost on a daily basis. And what he's saying is that we are just going to, we can trust, but we're going to verify. So whatever the CDC says is an acceptable vaccination, we want to run it through our own experts here in the state of New York. This council, these clinical experts are already prepared to do their own analysis. I'm not saying that we're going to have our own vaccine independent of the other ones, and no doubt about it, we want to make sure we get it out as safely and as quickly as possible. We have a plan already being developed in terms of distribution, prioritization, how we do tracking of the results, and we may actually have to come up with not just 20 million doses, but if it requires 2 times, 40 million doses. So the governor said we want to be the best state in the nation in terms of the distribution and implementation of a vaccination plan. So that doesn't mean we're going to come up with our own vaccination. It was simply going to mean that we're going to run whatever the CDC comes up with, run it to the rigors. We have experts, global experts, right here in our own state. We want to make sure it's safe for all New Yorkers before we start having it administered.
Meanwhile, New York City is joining Seattle in filing a complaint against the Trump administration for withholding federal funding for, quote, anarchist jurisdictions. What will the state's role be in that suit?
The governor said a month ago when this first came out, we actually have no intention of letting the federal government take away money in violation of the U.S. Constitution. That's exactly what it would be. Donald Trump is just trying to be a bully. So our Attorney General, Tish James, our governor, are prepared if they actually do take the steps to try to withhold funding. So certainly the cities have made their actions clear today. The state of New York has already said that we're willing to see you in court. And we expect they'll absolutely lose. Why are you wasting so much taxpayer resources and energy and time to do something, Mr. President, you know is going to fail in the courts? You know you're not going to win, just like you lost on the Trusted Traveler program, where you tried to suspend a program to allow people easy access through the airports after international travel or to cross over into Canada with ease. You tried to just single out and discriminate against New Yorkers to punish them. You lost in court again. So why don't you realize you won't win this? Why don't you focus your attention on something important like saving lives by having a more robust program to deal with COVID, more testing, just like we're doing in the state of New York. The other states need more testing, and how we're going to distribute a vaccination. I wish the president would focus on things that actually matter.
Finally, during those coronavirus briefings, we have seen the governor regularly. Tell us about what your role has been during the pandemic, and more broadly, when it comes to public service, what kind of future role do you see for yourself moving forward?
Well, I love being lieutenant governor. I've served in Congress. I've had every level of government position there is except for school board. So I'm very happy being lieutenant governor. I'm very proud of what Governor Cuomo has accomplished, without a doubt. While the governor has been working in Albany, I have actually been out all over the state. I've covered every corner in the last 2 weeks, just again, visiting testing sites, talking to doctors and professionals, finding out what their needs are, managing the COVID response from the second largest city in New York, Buffalo, New York, and the surrounding areas there, making sure that our healthcare professionals have exactly what they need. So I've also done a lot of communication, over 450 interviews to talk about how to get our message out on all kinds of platforms, whether it's country western radio, hip hop stations, public radio, public television, just to amplify the governor's message so we can get the buy-in from all New Yorkers. And now it's been successful. I believe that's one of the reasons why, with our transparency and our cohesive messaging, that New Yorkers understand they're the ones who determine our outcome. They wear a mask, they stay social distant, our numbers will stay where they are today, which is below 1% infection rate for the non-hotspot areas. And if you factor in a handful of hotspots that we're currently addressing, we're at about 1.1%. That's unbelievable, but we're not taking it for granted. We continue to rely on New Yorkers. So my role is to keep engaging with the public at large, and that's what I've been doing for the last 7.5 months.
New York Lieutenant Governor Kathy Hochul, appreciate your time. Thank you very much.
Thanks, Lane. Thanks for having me.